Are you worried about giving your baby the wrong dose of medicine? Here's how to do it safely and correctly each and every time. First of all, you do want to call your doctor to check in terms of proper dosing. Most commonly, what it's going to be with a baby is it's going to be anti-fever medicine. So typically acetaminophen, also known as Tylenol, Feverol, and ibuprofen, also known as Motrin or Advil. I do have a free guide, Fever Tips 101, and there are some dosing information in there. I do tell you though, make sure you call your doctor, because if your baby's having a fever, your baby's fighting an infection, and you don't want to just let that slide. You do want to have a follow-up appointment. And there's a lot of tips in there in terms of how do I know if I should have a follow-up, when to have a follow-up, when to order. But we're just talking about dosing for today. So you want to use the measuring tool that comes with each medicine. So the other medicine that might be used is Benadryl, for example. You want to make sure that you have a proper dosing tool. You don't want to do kitchen tools. You don't want to use teaspoons. For example, how would you do half a teaspoon? You don't want to use cooking spoons. You want to get a syringe that comes with the packaging, or you get a medical syringe that's made for medicine dosing at the pharmacy, for example. The other thing I always tell everybody to do is double check yourself. I double check myself. We're always giving prescriptions every day, and I need to double check and triple check myself, because it's all based on the baby's weight. It's all based on the child's weight. So you don't want to make a mistake if you looked at the wrong weight, not just the age. If you have a question in terms of, my baby's kind of on one lane with the weight and another lane with the age, call your doctor to be sure. Another important tip, write it down. Have a log. Give yourself a log that shows the date and time and name of the medication and the dosing that you gave your baby. And I have some of those also in one of my trainings. I do have a training that you can look into, and it's called the Pediatrician Fever Fix, and I have a whole bunch of different logs that are helpful. You can just make your own. Open up a little book and write your child's name, the date, the time, the medicine, how much you gave. Because guess what? In the middle of the night, nobody remembers when they gave the medicine last. And this way you can avoid double dosing or overdosing, because any medicine can be dangerous if it's not given correctly. I hope you found this helpful. Please subscribe to the channel and follow me on my other social media accounts. You can also go to my shop on my website, drsilvakidsgrow.com, and you can find free guides. You can find free guides and training. Some of my free guides are Mindful Mom 101, Fever Tips 101, 30 fun activities for when you're bored, 30 fun family activities when you're bored at home, and how to find a pediatrician, top 5 questions. Until the next time, please be kind to yourself, and bye-bye.